How to use health insurance enrollment tips properly. Beginner mistakes that cost you. Health insurance enrollment can be overwhelming, and most beginners make mistakes that cost them money or leave them underinsured. You won't believe how simple errors can have big consequences. The first mistake is waiting until the last minute. Open enrollment periods are limited, and missing the deadline can leave you with no coverage or force you into a short-term plan with gaps. Start early, research your options, and prepare your documents ahead of time. Another common error is focusing only on premiums. A low monthly payment might seem attractive, but high deductibles, co-pays, or limited coverage can make it costly in the long run. Always consider total out-of-pocket expenses and coverage limits. Many users also forget to verify provider networks. Make sure your preferred doctors, hospitals, and pharmacies are in network. Out-of-network services can be expensive or excluded entirely. A surprising mistake is neglecting prescription coverage. If you take regular medications, check formularies, and co-pay tiers carefully. Missing this step can lead to unexpected costs or denied coverage. Finally, beginners often ignore additional benefits like telehealth, wellness programs, or preventive services. These perks can save time and money while improving access to care. To properly use health insurance enrollment tips, start early, consider total costs, check provider networks, review prescription coverage, and leverage extra benefits. Avoiding these mistakes ensures you pick a plan that truly protects your health and finances.